Welcome back at 7:15. This week marks Cardiac Rehabilitation Week. This week recognizes the vital role cardiac rehabilitation programs play in helping patients recover from cardiac events and improve their long-term heart health. This morning, let's welcome Dr. Kevin Cartwright, a cardiologist at Touro, to explain cardiac rehab. Good morning. Thanks for being here.
Morning. Thank you very much.
Tell us what cardiac rehab is.
Cardiac rehab is a structured exercise and educational program for patients after they've had some type of cardiac event. It's typically about lasts 12 weeks, but can be longer. It's 36 visits. Most of those visits are a monitored exercise program. To where when I mean monitored is that they're actually get their blood pressure checked in between exercises. They're on a EKG monitor so we can see if there's any abnormal rhythms that happen, if we need to stop them from doing their exercises or anything like that.
And this is for folks, you mentioned folks who've had some sort of maybe cardiac arrest or maybe a bypass or anything like that?
Pretty much any cardiac procedure.
Okay.
So if they've had a heart attack, they've been in the hospital, they had a stent placement, just whether it's related to a heart attack or just because they had a blockage that we found, bypass surgery, or even valvular disease. There are some other special circumstances for heart failure or peripheral arterial disease that people meet criteria for cardiac rehab.
So in addition to this 12 weeks of meetings, what goes into that? Exercises or just blood pressure checks?
No, so they're typically it's about an hour's worth of exercise, and it's 3 to 4 different machines at the time, treadmill, elliptical, bike. It kind of depends on what their mobility is. Arm bike as well. And then educational elements for nutrition, why their medicines are important, help with any kind of risk factors that they have, kind of go over goals for diabetes, someone that can sit down with them a little bit longer than sometimes what they get in their
create a
physician.
plan moving forward. Have you seen improvements with patients that go through rehab for that amount of time?
Most people embrace the program and really do love it. And there's actually 3 phases of cardiac rehab. There's phase 1, which is actually in the hospital, kind of gets people moving out of the bed right before they get out. Phase 2 is the big part that we're talking about right now, which is the 36 visit program. And then phase 3 is actually just kind of like a gym membership. But I've seen patients that used to come see me in a motorized scooter, and then months later they're on a cane, and then a couple of months later they're walking.
That's incredible.
Without any assistance.
Do you find patients are a little nervous going into rehab at first, maybe after a procedure, and they're like, oh, I don't want to make this worse, or do you find that people get a little scared?
Not for what we're doing. It's not that intense, and it's kind of led by how much they can do. And kind of stepped up gradually.
Kind of meet them where they're at.
Yeah.
Okay, where can we find more information on the programs if someone is interested in learning more information?
There's several programs around the city. There's LCMC with Touro has a program. There's information on our website. And then there's also one at West Jeff and East Jefferson. There's a couple other independent programs around the city as well.
Dr. Cartwright, thanks for being here. We appreciate it. Good information.
Thank you so much.